Welcome, everyone, to the Eyecare Experts. Dr. Bell, Dr. Terrezza, and we have again with us Dr. Corredor, and we appreciate you being here. And I think
the invite.
We've got a pretty good topic, sports eye safety. Certainly the month of April is Sports Eye Safety Month, and just to flash back in time, when we first started doing our podcast here, I think this is one of our early podcasts we did back in the back room, so we're certainly a little bit more user-friendly. I think we're happier being out here, more conversational, talking.
But we look better, too.
Yeah. Sound better, look better. There you go. You can't beat that.
Yeah.
But no, it's certainly a pertinent topic with kids. Just, what do we need, how to prevent, if it occurs, what to do. Certainly we want to go through a lot of this stuff and hopefully answer questions you guys have, or maybe help you to prevent, an injury, because 90% of sports-related eye injuries are preventable. And so we want, before you go out there, especially, sports like basketball and baseball with balls moving at a rapid speed, before they kind of impact you, we want to do what we can to help with that. So,
absolutely.
What do you think? I mean, what would you say in general on sports? Yep.
My experience, besides being an eye doc, is also being in coaching sports, primarily soccer. But unfortunately, we have some injuries that came through the clinic. Balls hitting the eye. One of them had a massive retinal detachment. That patient lost half of his lower visual field because of the injury.
And that was soccer?
That was playing soccer, yeah, soccer playing. As recent as a few months ago, I had a kid over there playing soccer at school, and they weren't organized soccer. It was just at PE or something at the school, and they were knocking the ball around. This kid actually was a soccer player, but the ball came up, hit her in the eye, and of course, they came in right away. I looked at the patient and was pretty much referral to retinal specialist right away, because there was a little bit of bleeding inside the eye, and fortunately, there was no massive damage to the retina. It was just the impact and the bruise and the inflammation, but they happen. And like you said, a lot of them are preventable. Some of them are just accidents, and you can't do much about it. But
what would you say as far as protection or ways to help prevent, or things you would encourage or discourage?
Well, it reminds me of the old Ben Franklin saying, an ounce of prevention is worth a pound of cure. Just like detection of a disease, the earlier you get it, the better the results. So I like wearing safety glasses with polycarbonate lenses, all the standard stuff that you need, and just wear them all the time and reduce that chance to almost zero. That's good. You only get one set of eyes, so this isn't rocket science. You've got to, that's something that's worth spending not very much money on either, because non-prescription safety glasses are relatively inexpensive. So I like it for all kids at all sports.
And as far as, and I get this question a lot, and just to kind of add to that, when we talk about polycarbonate lenses, can that be put in a regular frame? Does it need to be sports safety frames? I mean, what would you recommend with the lenses themselves?
No, you can adjust it. So the difference in a safety pair of glasses is the bevel on it. So that's the edge of the lens. And you can put a zigzag bevel, you can put a front end bevel, blah, 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 as a seesaw bevel. All those are special, so that lens will be very resistant to coming out. But even a regular pair of glasses, if you have polycarbonate in them, they certainly won't crack, and nothing will penetrate them outside of a sharp projectile.
Yeah.
And even polycarbonate has its limits. Personally, I had an experience. I used to ride motorcycles, and I think Dr. Bell used to. I was out riding in the country when I was in Texas, and this bird popped up, and I had a visor made out of polycarbonate lens. And that lens, because of the impact, it did crack, and it hit me in the eye. But the bird didn't hit me, it was the poly that when it flexed and cracked, it hit me in the eye. Of course, I had a massive inflammation, no damage to the eye, but it put me in bed for a week with a massive iritis, a massive inflammation of the eye.
Well, I guess I would say to that, we talk about scratch-resistant lenses. I mean, certainly it's harder to scratch a lens. It's not 100% scratch-proof, and polycarbonate isn't going to stop everything. But in general, polycarbonate is 10 times more impact-resistant than regular lenses, and it doesn't shatter, like regular lenses. So, I mean, certainly, depending on what came through, it still could break it. But
I'm sure different degrees of it, too. Yeah. Because you can have a 2 millimeter central thickness, or you can have 3, or you can have 4.
Right.
Very little is going to go through a 4. Oh, yeah, absolutely.
So glasses, the other question I get quite a bit is, well, my kids wear contact lenses. What is that? Well, contact lenses usually you wear to see good, but that's not going to help you with something coming towards the eye. So in that case, if the kid wanted to wear contact lenses, maybe they wear safety goggles on top, or we can certainly put prescriptions in the safety goggles depending on what the need is or what they're wanting, I guess, and needing what their prescription is to begin with. Is it a high prescription, low prescription, that sort of thing.
And I'm a big proponent, being a sports coach and an eye doctor, I'm a big proponent of putting kids on contact lenses for sports, especially if they're going into a more competitive level. And I do take into account that it's a risk. They don't have the goggles, they don't have the glasses anymore. But also I look at, what kind of sport they're playing.
Sure.
Because if they're thinking about racquetball, now that's a ball that is traveling at high speed, and it can replace an eye.
Yep.
Easily. It can displace the eye and then get embedded. We had an incident like that when I was stationed in North Dakota, where the eye basically lost its eye because wasn't wearing the proper equipment, and it went right through, and it just basically knocked the eye out, and the ball got in there.
No, that's certainly valid depending on the sport that you play. I know for me growing up, I wore contact lenses all the years for football because it was just hard for me to fit a frame with my big head underneath the helmet. But contacts work better, but for the other sports like baseball and racquetball, of course, those are ones where I didn't wear contact lenses and I wore prescription safety glasses.
Yeah, absolutely.
To help with that. But, there's so many injuries that occur, like we said, that could be preventable. Also, if things happen, we want to make sure, to give us a call, whether you think it's minor or major, if there's any pain, any double vision, any blood, even if it's superficial. There's things you can see on the surface, but it may be worse inside the eye, and certainly even like a retinal detachment, we'd have to look in the eye to be able to tell. But, give us a call. We always have openings for office visits, same day, work-ins. We want to see you as quickly as we can, because in some of these conditions, the earlier we catch you, the better the outcome it is. And we want to assess it, and if we need to get you to a specialist, we certainly will do so. I think that's the good thing about coming to our offices, that we have a good relationship with pretty much every surgeon in the area. Whatever procedure they would need, we can get them there. I would say is about as fast as anybody.
And the other thing is we take 99% of insurances, so we're able to work with surgeons that are on some plans and others who are on others. And we know how to maneuver that system to get you the care that you need.
Yeah, take
Absolutely.
pretty much any vision medical insurance for this. If it's an office visit, usually it would fall under medical. For patients who come in for a routine vision exam, an annual once-a-year deal, that could go either way. That could fall under your vision plan or medical plan, depending on what your diagnosis are. But I know Dr. Terrezza has worked very hard. If you don't even have any insurance, we worked as hard as we can to keep costs down, so that we don't, price gouge patients that need our care. And if, that's the case, give us a call and say, hey, I've got this insurance. We can look it up for you. We have a team to do that. Do you have a copay? If you don't have any insurance, what's it going to run you today? We always want to let patients know as much as we can on the front end, so you don't have, on the back end saying, hey, here's a big bill. We want you to be aware of the process. And insurances are tough anyway. So, we do this every day, and we have a team helping us, but sometimes it's tough for us. So we want to help the patients out, help you guys out as much as we can, certainly with as much information as we can give.
That's become a critical part of our practice. For instance, if a patient comes in, requires some medications, we look up the specific insurance and what medications are covered by that insurance, and then find out what that is and prescribe that for you if possible, saving you serious money. It takes up time and effort to do that, but we're more than willing to do that.
Yeah, and in a lot of cases too, some of the companies that provide the prescription drugs, they're willing to work with us at a discount or provide at no cost to our patients too, through our representatives that we have with the drug companies too. So there's always ways to work things around for our patients.
Well, we talked about a little bit about safety, but the other side I see of it is, do they have a prescription? Do they need glasses? The question I get from a lot of moms is, my son has this prescription. Would you recommend that he wear it for this sport, however? And then I usually say, hey, what sport is that? Is it kickball? Is it, is it tennis? But some of them, especially like baseball, if they have a prescription, Usually that helps them to pick up the ball, especially if it's a fast pitch baseball, to pick the ball up a little sooner. Depth perception helps, binocular vision helps. So in sports like that, it's a good thing to come in. Let's do an annual exam, see if the kid has a prescription, because we want to give them any advantage that we can give them visually. Maybe they're seeing it, but they're not, picking it up until it gets closer to them. And so a lot of things don't come up until we get the full exam and we assess the health of the eye, the full vision of the eye, and just kind of see what's going on.
Oh,
Absolutely.
Yeah, absolutely.
The kid that can't see well will perform less, and then his self-esteem is tied to that. So how he performs on the field, he will transfer that feeling and bring it to other aspects of his life, and that's unfortunate. And if we can fix that and realize that that was the limiting factor, not his ability or his talent or how he was motivated to perform in athletics, then that's a serious change.
Oh, it's critical. I so agree with both of you. If we can maximize vision performance, they can maximize their performance in the field, especially in things like tennis, baseball, hockey, where you have that small object coming at a high rate of speed. If you don't have good vision acuity or visual perception, that perception is going to suffer, and then you're not going to be able to judge that ball or judge the puck or whatever the case is, to either hit it, catch it, or do whatever it is that you need to do in the sport.
Well, I know you've done some of this in the past, and I certainly have too, is we talk about sports vision training. What's the first thing we do with sports vision training is figure out if anybody has a prescription, and then we try to increase the reaction time. Well, what's the main thing that's going to increase the reaction time is seeing something sooner, seeing it sharper, seeing it better. And so that is a critical component to anybody who's looking for an edge, because in sports, reaction time is critical.
It's critical.
Yeah, as
It's
far as
key.
picking up a ball, hitting it back, if you can pick it up and move faster, you're going to be in a better position to have certainly a better chance to maybe return the ball or whatever sport you're playing.
Yeah, create the play and be ahead of the opponent team.
Yep.
You want to be ahead of the ton. When I was doing some of that sports vision training with the military pilots, the idea is for them to be ahead of the plane, not behind the plane. Because if that's the case, there's too late. They can, it can have some serious repercussions for the pilot to the point that they can crash the plane. But we wanted them to perform at the highest level, giving them that extra edge, that extra half a second worth of that perception of or reaction time.
Well, especially, I know parents are, some of these sports, they are not cheap.
I
Some
know,
of these
yeah,
traveling
it is,
sports soccer teams,
I
I
know
know
my
what
kids
some of
play
my
sports
friends
too,
are
and I
paying.
coach them, yeah, it's not-
and then
it's
they
not
pay
cheap.
for self-coaching, extra hours tutoring. They're spending money, big money on hundreds, if not thousands of dollars for these kids. And we're just saying, just don't forget about the eyes. Certainly let's check it out, make sure.
I was going to, stump on that is that sometimes the last thing they think is, well, they see fine. Little Johnny, I have no problems. They can see fine. And then it comes to find out, it's like, it might be a small amount of prescription, and that takes them to that next level.
Yep.
So,
And it could be one eye. I get that sometimes when they come in and they, he sees fine, but maybe one eye sees and one eye seeing better than the other one, but the other one doesn't see as well.
Exactly.
And that may be suffering a little bit there. But anything we didn't cover or anything we're just talking about? I guess we talked about this a little bit, but certainly if anything happens, give us a call. If you're hit in the eye, especially if it's bruised, the orbit of the eye, the bones are very thin. Sometimes you can have a break or rupture and not even know it. Hemorrhages, corneal abrasions. I've had some people that wouldn't call, but the cornea has a lot of nerve endings. And so if you have even the slightest abrasion, something scrapes the eye, metal gets in the eye, rock from a weed eater comes up and hits you in the eye, it can be very painful. And it can do damage, but also you can have bacterial infections as a result of the abrasion. Sometimes the secondary infection can be worse than the primary. So those are things that need to be addressed and seen.
the bottom line is protection. Not just in sports, but in everyday life. I think, at our Milton office, we have a lot of guys that work in cars and machines and tools and all that stuff, and you're grinding pieces of metal that are hot, sharp, and coming at a fast rate of speed. And if you don't have glasses or any kind of at least protection, those things are going to get in there. And I love digging them out. Don't get me wrong. I love digging things out of people's eyes.
So it's fun for you, not fun for them.
It's fun when you're on this side of the chair and not on the patient side of the chair. So, like we mentioned, we can always see those patients right away, but we'd rather them not come in with an injury if they wear the right equipment and the right protective gear.
Well, I know I used to work in Jacksonville, Florida, and we used to work up the street from Tulsa Welding School, so I'd see someone at least once a
Yeah.
week that had metal in the eye. And I would say on average, I don't know what you guys, that may be something to discuss, I'd say on average every month I probably have 2 or 3.
Yep, 2 or
that have
3.
metal or fiberglass or
yeah,
something
2 or
in the
3,
eye.
yeah.
Mine's sporadic.
Yeah.
Sometimes I'll see a bunch, and then I'll go a long time without, haven't seen one in a while, actually.
But the toughest ones to remove are the ones who don't come in for weeks.
Yes.
If it's the day of or the day after, usually it's superficial and you can just get a spud and just kind of, dislodge the metallic foreign body or whatever it is. But the ones who just say, I'm going to get by, and they grow a week or two, and then the epithelium grows over the metal, then you've got to break
You
the
gotta
epithelium, get in there, and it's a little bit tougher to get out. So the moral is, come in sooner. The sooner it is to dress it, the easier it is to get out, the better we'll get you on the right antibiotics, get it taken care of, and help you. But we want to thank you. As far as patients that are looking for you, tell them a little bit kind of where you're working at,
Yeah,
locations.
so
Yeah.
I used to be at downtown Palafox and the office out in Fairfield, and now I'm primarily at the Milton office and the Navarre office.
Okay. So Milton and Navarre, and certainly you can go to our website, TerrezzaOptical.com. It has all of our locations. Each office has its own office number, so if you know which particular office you want, you can call that directly. But even if you call another office, we can usually direct you and say, hey, this may be closer to you, or maybe you want to see Dr. Corredor and you want to go to that office and you live closer to another. Whatever you want to do. We're all on the same system. We want to get you seen with which provider you prefer to see, which location. There's a lot of, we all have the same equipment, but I guess the biggest difference in some locations is the optical. Sometimes there's different frame selections, sunglass selections, depending on where you go. But good topic, especially coming up here with spring and summer. We want everybody to be aware. Let us know if we can help you in any way. Go to TerrezzaOptical.com. Call us if you need us, Dr. Terrezza, Dr. Corredor, Dr. Bell. Thank you, guys.
Thank you.
Appreciate it.